The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Welcome back to It Takes Balls, presented by Testicular Cancer Awareness Foundation. Today I'm joined by a teacher from New York. I've got Jon Fox with me. Jon, thanks so much for being here.
It's absolutely my pleasure. Thanks so much for having me.
So, of course, the reason you're here is because you're a testicular cancer survivor, and you were diagnosed at age 38.
I think I was 37, about to turn 38. I think my
Okay.
sense of time is off. Yeah.
So you're kind of, not that that's old, but you're kind of in like the later range of the age range. I mean, TCAF says 15 to 44, so you're not quite at the end, but almost there. So what, like, was testicular cancer ever on your radar?
No, not at all. And I would say before my experience, I mean, I guess I had heard of it vaguely, but had no conception of it, and certainly no conception of it being something that could happen to me or anything like that.
So at 37 years old, you're a teacher. Like, where were you? Was it during school that you felt something going on? Talk to me about like when you first noticed something was different.
Yeah, so this was that, I don't know to what extent other people are aware, but in terms of school, this was the school year where it was the year after the pandemic started. So this was a school year where most no. So it wasn't the year where things were hybrid and like remote, and like that was the prior year. This was the year after that where everyone was back to school in person full time, but everyone was wearing masks and social distancing, and all those rules were in place, or at least that was the idea. And when this happened for me, it was, I guess, I can't remember if we knew or had a sense, but it was approaching the time when we were like just about to come out of all that. Actually, it was like a month or maybe even less after I was diagnosed and after I left, because I left school when I got sick and everything, that they lifted the mask mandate. And so, of course, it was like kind of, or no, wait, maybe. Yeah, it was. Yeah. So it was kind of sad for me that I never, I actually can't remember now if I like just made the cutoff. I may have been there like for the day that the masks were lifted. I can't even remember.
That's all right. We'll blame the chemo for that.
Yeah, it's actually, I could just be getting older, but I always had a really good memory. But I mean, honest to God, I mean, ever since this experience, maybe just the stress of it, my memory is terrible now.
Yeah, I think that's relatable. So anyway, no matter where you were, like what was the first kind of thing that you noticed with your testicle?
Yeah, so some of this is in hindsight, right? Like looking back with hindsight, I can say like, oh yeah, I do remember this, but like at the time, a lot of this I was not conscious of. And that being that, like in retrospect, I do remember like noticing that like the size of my testicles were a little unusual, meaning that like one was bigger than the other. And the first thing I noticed was pain. That was the very first sensation that I remember being like, huh. And it started off as just like a mild ache in my left testicle, which I've had like a few times in my life before, probably, even going back to when I was a teenager, like, like you just, your testicle, your ball kind of aches, and usually it goes away in an hour, goes away in a day, like that kind of a thing. And I'm assuming like it's just like a blood vessel, like whatever, who knows? And I think at first it went away and then it like came back. And then it was like 3 days where it persisted without going away. And that's when I'm like, okay, like this is unusual.
Mm-hmm.
And I'm like, but again, not thinking anything of it. I'm like, all right, I guess I need to see a doctor, or like, So my dad's actually a doctor. He like knows doctors, and so I'm like, hey, Dad, I think I need to see a urologist or whatever. And he knows a urologist, so he's like, all right, call this person's office, like, this is the urologist I've seen for 20 years or whatever, and he's really good, and tell him, you need an appointment, you have pain in your testicle, whatever. So I do that. And the soonest appointment that I can get, even with my dad knowing the guy, is 2 weeks from then. Mm-hmm. So I take it, like, all right. And of course, a lot ends up happening leading up to that appointment. But, the pain sort of gets worse. And then there was, I think maybe like a week after the pain started, there was a day where I woke up in the middle of the night with severe abdominal pain, severe. And it was like strange, like not like pain I've had before. It really freaked me out. It eventually subsided and I fell back to sleep. But then when I woke up after that, I went into work and I knew that, like, because of that scary, weird episode in the middle of the night, I told my assistant principal at the time, I was like, listen, on my, like, before lunch on my prep, like, I want to go to urgent care because I had like a scary thing last night, whatever. And she's like, okay, no problem. So I go to urgent care, and the person, I don't know if it was a doctor or nurse practitioner or someone who sees me, the first thing she like notices, she's like, well, like, one of your testicles is way bigger than the other. Mm-hmm. And like when she said that, it like registered with me, like, oh, like, yeah. And like, I knew that ever since it was hurting, it was swollen. But I don't know, like, I think most guys don't really pay too much attention to their balls. They're kind of like an afterthought. And I certainly never did. And so like, I remember Googling, like, is one ball supposed to be bigger than the other? And it's like, yes, but like probably not to the extent that mine was.
Yeah. Do you have any comparisons?
Comparisons to
like, could you compare like the size of, the normal one to the one that was affected, like maybe with a fruit?
Oh yeah. Well, I think, by the time that I went to urgent care, oh man, I would say the normal one was maybe I could be wrong, but I want to say a grape.
Okay.
But maybe that was just the appearance. And then the affected one was, I mean, what fruit would be this? I don't even know.
Or like a tennis ball or baseball or something.
I wouldn't say as big as a tennis ball or baseball, but maybe a little bit smaller than that.
Okay.
Something like that. So at urgent care, they're like, she's like, you need to go to the emergency room, like, right now, because, like, I think she thought it was like torsion or something. And she's like, you could lose the testicle, right? Like, you could be like, circulation could be cutting off, whatever. So I'm like, okay, like, so I call my dad, and where I live, like, the local hospital is terrible. Like, do not go there. Like, they'll kill you. So, but like, fortunately, like, just like drive over the bridge, go to Brooklyn, go to NYU. And, he's like, I'll take you to the NYU emergency room. So my dad drove me to the emergency room, and I ended up spending all day in the emergency room, like 7 hours. And, they were like, oh, they did a sonogram, they did all these things. And, they were kind of like, all right, well, we're not sure, but like, it's probably like epididymitis. They gave me antibiotics. And the one thing is that we were like all done, we thought, and then they're like, wait, before you leave, like, we want to get markers. And at the time I didn't know what markers meant. And like blood markers, they called them. And I wonder if that was like intentionally discreet.
Yeah.
And thank God that they did that, right? And I remember, like, we waited like another 2 or 3 hours for someone to come and get these markers, and like, we didn't, like, what are we still doing here? Of course, now we know, like, they were tumor markers, and they were being like a just in case. And thank God they did, because so anyway, they sent me home with antibiotics. I was not feeling better on the antibiotics. And I do remember looking at the sonogram report, and I remember it said something like, it said like differential diagnoses, blah 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 blah, and then there was like a phrase at the end that was like tumor, like less likely. Like it kind of made it sound like, there's like a small chance that it's a tumor, and so I was just like, all right, that's a little scary, but like, all right, it's probably just part of the all possibilities since they can't definitively say what it is. But I wasn't getting banged on the antibiotics, blah blah blah, and a week after this, which was actually either the same day or like the day before that urology appointment that I had made. I get a phone call in the morning from NYU, and that phone call was like the first like ominous harbinger of like, oh shit. They were like, and that was also right when those tumor markers came in on the my chart, and like I see these things, you have a new test result, and I see like tumor markers, and I see like normal range, and I see like what mine, and it's just like, wait, what's happening right now, like what the fuck. And they get this phone call, and they're like, and they wouldn't tell me over the phone, but they were like, this isn't a diagnosis, this isn't anything, but like, please see a urologist. And I'm just like,
do you remember what they were? Like, how far out of range were they?
I do remember. So they, they were like so there's three of them, and I think two of them were like a couple hundred higher than normal, and then the other maybe was like 50 or 100 higher at that time.
Yeah.
But yeah, so that was like, and then I would say like that was just like shock, like, oh, like, do I have cancer? I think this means I have cancer, like that kind of a thing. And then I think I just went into a state of like, all right, but let me just suspend thought or feeling until I like get a diagnosis and see the urologist, and like there's got to be some other explanation, like. And then I went to the urologist, and like I remember just like so panicked, and I remember telling him like, he's like, oh, how's it going? I'm just like, well, I'm like ready to like freak out. Like I'm so nervous or whatever. I'm panicking. And he's like looking at all my stuff and like the sonogram. And he's like, oh, there's no reason to panic yet. Well, hold on. And he's like looking at everything. And I think he must have been looking at like all the lab results. And I think when he saw the tumor markers, I think that's when he's like, oh, okay, yes. And then he was like very, I don't know, like serious, like trying to be like kind, but like with capturing the gravity of the situation. Like, yeah, it is testicular cancer, and that's the beginning of how I knew.
Yeah. So when you were like you got those lab results and you're waiting those 2 weeks, I guess maybe it wasn't fully 2 weeks between your markers and everything and your urologist, but I assume you're back to work. Like, does that affect you when you're teaching your students? Like what grade level are you teaching in? Would they have noticed any difference in you?
So I was teaching 5th grade at the time, and that weird abdominal pain was just like a one-time thing at that time. And I had the testicular pain, and so that was uncomfortable for me, but I don't think it showed in my demeanor or anything. I don't know. It's possible that like I was just like, oh, guys, I'm kind of having a bad day. Like, just behave, please. But yeah, no, it didn't. I would say it didn't affect me at all at that time. Just that I was like in pain. Yeah.
Well, that's good. All right. So I know in your submission you put that your initial treatment plan you didn't feel was right. So talk to me about what you mean by that.
Yeah. So, okay. So, all right. So fast forward, everything happens. And, so I had the orchiectomy, and so I had metastatic disease. So, I needed to do chemotherapy, and, I'm a researcher. I learned a lot about the nature of testicular cancer and oncology and everything at this time. So I had a pretty good understanding of everything. And so I was assigned an oncologist at NYU, and he like gave me the treatment plan and everything. And I was in and out of the hospital too, like because of just things that had happened. And when he gave me the treatment plan, I questioned it because he put me in the poor risk category. For people that don't know, if you have metastatic disease with testicular cancer, you're put in one of three categories: good risk, medium risk, or poor risk. And obviously they're kind of like what they sound. And if you're in good risk, even with metastatic disease, as many I'm sure know, like testicular cancer is so treatable. Even if you have metastatic disease, if you're in good risk, like it's still like 90% cure rate or something like that. Medium risk is like slightly lower than poor risk, depending on like the studies that you look at and the data that you look at. That's it. There is like a sharp decline. I mean, it's not like you're going to die for sure, but it gets scary. Depending on how you read the data, it can be like 60% survival rate, cure rate after 5 years, something like that. And significantly, if you're in poor risk, you have to do 4 cycles of BEP, or depending on if you do EP. But if you do BEP, which is a standard, usually like the typical chemotherapy regimen, if you're in poor risk, you have to do 4 cycles. Whereas if you're good risk, and I believe medium risk, you do 3 cycles. And I was obviously scared of being put in the poor risk category for just my survival. And I was also very concerned about the toxicity of the cisplatin and hearing loss and neuropathy and all these things. And so anyway, I'm sorry, I'm going on a bit of a tangent, but the reason why I questioned it is because, I was put in the poorest category, even though my only metastases were, I had abdominal metastases, lymph nodes, and then metastases in my lungs, small nodules in my lungs. My tumor markers were elevated by a few hundred. So the guidelines for putting someone in risk category, if you have tumor markers less than 1,000 and the only organ metastases you have is the lungs and no other distant organs, that's the criteria for good risk category. So I fit that description. I think one of my tumor markers was like borderline, but that was the non-specific one. That was the lactate dehydrogenase, which was more of a non-specific inflammatory tumor marker. So I asked him why he put me in the poor risk category, my oncologist at NYU, and his answer was that one of my lymph node tumors, which was right behind my left kidney, and that tumor was causing me significant pain because it was. He said that like the radiation oncologist, like or something like that, was like very concerned, and that they had like a tumor board meeting, and because it was like that tumor was like potentially starting to invade my psoas muscle, and that was like a sign of like really aggressive disease. I'm like, okay. So of course I get home and I start researching that. Couldn't find anything in the literature about that being like a criteria for affecting what risk category you're put into or anything like that. And so I emailed Dr. Einhorn and got his take. Oh man, I can't emphasize enough like the admiration that I have for this man and like what an incredible human being he is. And like I was even just astonished that he wrote back to me like within an hour. Like,
yeah, the conference was a couple weeks ago, and you got to meet him.
Right.
We're recording this before the conference. We're just pretending, but you will get to meet him.
Oh man, yeah. So he wrote back and he was like, I would put you. He was like, yeah, no, I would not put you in poor risk category. So I wrote back and I was like, okay, should I switch my care to somewhere else? Like what, and he was like, he's like, well, Dr. Feldman at MSK is excellent. So I immediately decide, all right, I'm going to switch to MSK, or at least get a consult, go through that whole process. And so when I met Dr. Feldman, I start like telling him this whole story that I just told you. And like before I could even get the story out, he's like nodding his head, like he's like, no, you should not be in Porter's category. In like psoas muscle involvement is like very common. He's seen it a bunch of times. Like, no, you should only be doing 3 cycles. And like he confirmed exactly what I suspected and thought. And like I can just tell, like, all right, this is the doctor for me. Like, I mean, the NYU oncologist, I mean, he just wasn't as experienced or for whatever. And this is like, again, I don't know if people appreciate, I feel like people that are outside of the cancer world don't understand, like doing an extra cycle is huge. Like the toxicity you're exposed to, like, I don't know if you know anyone, like, I don't know anyone who has done 4 cycles of BEP that doesn't have, hearing loss, permanent hearing loss, or permanent neuropathy, or things like this. And you could still get it with 3 cycles. Fortunately, I didn't. But if I had done a 4th cycle, like, it would have been devastating.
So, like, when you kind of talked to Dr. Einhorn and switched your care, had you already started like your first round of BEP, or like what was the timeline there?
Yep. It was either finishing up my first round of BEP, or like I just finished my first cycle of BEP.
Okay. So yeah, so you like your track was headed right towards 4 and veered off. That's good.
Yeah.
So talk to me about like your experience with chemo. I know you just mentioned like the toxicities would have been worse with 4. Like what kind of symptoms were you experiencing throughout?
Yeah. So aside from the long-term effects, I also, now having gone through it, like I don't see how I can't imagine what a 4th cycle would have been like, because for me, the first cycle, I remember, like, it sucked. It sucked quite a lot. But like, I remember, like, after I finished it, I was like, all right, well, like this wasn't like so bad. Like I could do this. Like, I guess I got this, I think. But then people were like, just like, brace yourself. Like I remember, like, people are in like support groups were like, first cycle is like a bit of a tease. And then the second cycle was significantly harder. And I'm like, Jesus, fuck. Okay. And then the third cycle was absolutely horrific. So for me, my symptoms, I would say the worst thing, like the most memorable thing, just because it was like chronic, was nausea. And like, that was like in the third cycle, I would say there was like, even after I finished, it was like 2 or 3 weeks. Because, okay, so the first cycle, I would say it lasted, I don't know, maybe like 3 or 4 days, and then subsided, just the way that the cycle works, and because then you get a little break. Then the second cycle, I think it was like a week where it lasted. And then the third cycle, it was like 2 or 3 weeks, where I was just like absolutely sick to my stomach. And it just round the clock, just nauseous. It's just that feel, like, imagine feeling nauseous just all the time. That's what it was for me. There were days that I had fatigue, but like, it wasn't very memorable for me. Like I almost like didn't care about the fatigue. Something that was really horrible, but it was like short-lived, thankfully, was like the throat. It's like, it felt like a really bad sore throat. And I think it's like the lining of your throat being destroyed or something like that. That usually happened like once per cycle. There was like a weekend where that happened. And that was like really annoying, but it only lasted for like usually 2 or 3 days. And then of course, like messing with like your bowel habits, and is like really annoying. And in retrospect, I think it really disrupted my gut microbiome, and like, yeah.
Yeah. I know you mentioned earlier that you had left your teaching job when you got sick. At what point did you make that decision?
So when I knew I had to have the orchiectomy, so like that was going to be at least like a week out. And then And then I think I knew I was going to have to do chemotherapy. And so like, I think initially it was like a mental thing. Like I knew that I would not be able to function mentally there because I was so distraught. And like, I think, I don't know, maybe any job that would have been the case, but certainly as an elementary school teacher, there's no way I would have been able to hold it together in front of the kids. Like I, yeah. Yeah. So that decision was made early on, and actually, but then like my last day was planned, like, all right, I have the orchiectomy is scheduled a week from now, and like the day before is going to be my last day. And then I actually get a call at work from the surgeon, the oncology surgeon, who's like, and which is like, that's, and scared the crap out of me, because when does like a surgeon ever call you himself? And he's like, yeah, like, could you come in tomorrow? And because he had like seen my scans and everything. And I think it was like, yeah, like my disease, was like started out with this like mild pain in the testicle. And then like within weeks, like it escalated. Like I was in like just agony from like the tumor behind my kidney and my psoas muscle, and like getting like chills, and like it was like rapidly escalating, and it was a whole thing. Yeah.
Yeah. And we'll talk about your RPLND and Whipple in a second, but while we're on the topic of work, did you make it back to work that school year?
No, I was, I finished chemotherapy, like sometime in May, and my white blood cells were like still incredibly low for like a while, like a month, like at least a month after that. And then also I knew that I was having to have the RPLND and the Whipple surgery in, it actually ended up being June 16th. So I did not want to risk getting sick or having any complication. And it was actually heartbreaking for me, because that year was like my first 5th grade class at this school was graduating from 8th grade that year. And like, so, like they really wanted me at their graduation. I want to be at graduation, and but I couldn't. Yeah.
So let's talk about your Whipple that you mentioned and the RPLND. Which came first, and how did it go?
They came concurrently.
Oh, wow.
I had, so because I needed an RPLND and because I needed a Whipple, thankfully my amazing surgeon at MSK, for the Whipple was like, we could probably do both at the same time. And at first I'm just like, what? But then when I thought about it, like, yeah, because like one surgery, one incision, one healing recovery, like this would make sense if it can be done. And he's like, I think it can. Let me find out. And he's like, do you know like who's gonna do your RPLND? And I'm like, I want Dr. Scheinfeld to do my RPLND. And Dr. Scheinfeld, another one, the man, the myth, the legend. And they coordinated, and they were like, yeah, we can do it. So I had a 7-hour surgery where Dr. Scheinfeld started, he scrubbed in, he did the RPLND, he scrubbed out, Dr. Drebin scrubbed in, did the Whipple, and yeah.
So I think everybody here maybe knows, and if they don't know what an RPLND is, there's an episode with Dr. Clint Carey about that. But the Whipple, I don't know that I fully know what that is. I've heard it on Grey's Anatomy. So what exactly is the Whipple?
Okay, so the Whipple historically is considered like the magnum opus in the repertoire of a surgeon. It's incredibly complicated, difficult procedure historically, and also carries extreme morbidity. And I would like, until I would say recently, I would say like the past like 10 or 20 years, and even, and also like when it's being done at a high volume center, that helps a lot. But like in the past, like oftentimes like patients would just like die on the table in a Whipple surgery. It was like such an extreme thing. But so what it is, it's a Whipple surgery is indicated when you need to remove either the head of the pancreas or the duodenum, because those two parts of the body share like the same blood supply, something like that. And so like if you remove one, you need to remove the other, which means you need to totally reconfigure the digestive tract. So what a Whipple surgery does is you remove the head of the pancreas, you remove the gallbladder, you remove the duodenum, which is the first part of the small intestine, you remove the common bile duct, and you then reattach things and reconfigure things. And yeah, and that's, oh, and I should mention that again, historically, classically, a Whipple procedure also removes part of the stomach. But these days, what's much more common and what was done in my case is called a pylorus sparing Whipple. So they spare that pylorus sphincter, that part of the stomach, and so they didn't have to touch my stomach at all.
Nice. Was that related at all to the testicular cancer, or just happened to be at the same time?
It was not related. I am one of the very lucky people that had two distinct malignancies simultaneously. I had a neuroendocrine tumor on my pancreas that was found in all the imaging and staging of my testicular cancer, completely unrelated to my testicular cancer. By the way, my theory is that this is why the NYU doctor said I put me in poor risk. I think that he just assumed, and everyone assumed, that that mass in my pancreas was more metastases from testicular cancer. So he probably figured, oh, there's more organ metastases other than the lungs. But when you talk to anyone in certainly the testicular cancer world, and even anyone with any background in oncology, it becomes very clear that metastases to the pancreas from testicular cancer is virtually unheard of. Like I had doctors that like in 30 years of practice, I had never seen testicular cancer go to the pancreas. It just doesn't like that pathway. So yeah, unrelated.
Yeah. So when you said everyone kind of thought that it was initially, what was the point that they determined that it wasn't related? Was it like after some chemo and scans, are like, oh, it's still there, or what was the deal?
No, because the standard of care is if you have a mass on your pancreas that it's unclear, they do a biopsy. So they did a biopsy of it, and actually even from the imaging, like the radiologist is able to be like, based on what it looks like, it's probably a neuroendocrine tumor. But then they do a biopsy, and then it was confirmed it was a neuroendocrine tumor.
So talk to me now about the recovery from the RPLND. Obviously, you had kind of double damage going on inside. So how was the recovery process for you?
Yeah, so it's a little difficult to distinguish what was the RPLND and what was the Whipple, since I did have both at once. But I mean, I feel like I have a pretty good idea. And so the recovery was absolutely awful. As bad as chemo was, again, and maybe this is because I had the two surgeries at once, like the recovery from that major surgery that I had, like those 10 days, I was in the hospital for 10 days after that surgery. And like those 10 days were like not even close, without a doubt, the worst 10 days of my life. Like it was just utter misery. And then even after being discharged from the hospital, like the recovery, like I would say, the 6 weeks following, the 6 weeks after the surgery were so tough. The 6 weeks was the magic number for me that I started to feel better. But I was in tremendous pain. Like in terms of the RPLND specifically, that caused pain. It caused pain in my lower back when I would lie down and try to sleep. So sleeping was incredibly difficult. I'm assuming it's because that's the retroperitoneum, and that's the area where all the surgery happened for that. And so you must have just been very tender and sensitive. And like trying to like lie down was agony. The Whipple surgery affected my digestion and ability to eat and that sort of thing. So that's still, that's forever. So it has gotten better, but that's a forever issue. What else? I mean, it was just a lot of pain, a lot of stress. Oh, also for me, the RPLND, and this is something they didn't tell me about. This was not listed as like, oh, this is what may happen. I had like I would say it was like numbness, but like painful numbness in my upper left thigh and like left groin area. That lasted for um, a couple months,
Mm-hmm.
so like after the surgery, and I would say it's like not 100% gone. I would say it's like maybe like 98% gone, but there's like still like I feel like there's like an ever so slight like I don't even notice it anymore. I've gotten used to it, but and I'm assuming that's because my since it was like most of my tumors and everything were on the left side, and like there's just like extensive work there with the nerves and everything. I think the yeah.
Yeah, I have the same thing. I definitely had left leg pain, left thigh pain, and now like even if I touch it, I feel like it's still kind of numb. So yeah, I think yeah, we're twins there. So talk to me now about like how survivorship has been for you.
So it's been very difficult. It's been difficult in a different way, right? Like the immediate aftermath of the surgery was like insane, and like I would probably do anything to not have to do any of that again. But survivorship has been difficult in terms of just like long term, day to day, big picture stuff. Actually, do you know when this is going to air?
The 22nd or the 15th of November, 15th or
Oh,
22nd.
okay. So by the time this airs, like, so I'm actually, I'm applying for, I'm just this weekend, I'm going to apply for first going to apply for like a leave of absence due to medical hardship and restoration of health from work. Um, because I find that I really I can't slash no longer want to be a classroom teacher anymore. Um, with like the physical issues and also the mental issues, like dealing with like the constant stress and the sensory stimulation. I can't do it. And so it's a very scary time for me. I have to figure out what I'm going to do now, like a whole new career, a whole new pathway in life, which is like both exciting but scary. Like I need to pay the rent, I need to pay the bills, and and I also I'm gonna having another surgery soon, so like I need health insurance, and it's because so unfortunately my incision, which for both our RPLND and Whipple, it's like this really big incision down your torso. My incision formed a keloid, so it's really uncomfortable, really ugly. And so I'm having surgery to address that. So yeah, it's incredibly difficult. It's a lot of like, I've been in therapy ever since my diagnosis. I've been in support groups, which have helped tremendously. But it's like trying to accept that this happened and like to reframe it as like I'm not a victim, I'm a survivor, and like the feelings of like why me? This is unfair. Seeing other people that like can do things and like live like a normal life, and like you kind of like there's like a natural part of your mind that goes like why can't that be me, right? It's not fair, right? But like trying to overcome that and like focus on like listen, I'm not everyone survives, and like I'm immensely grateful, and like I was given a gift that I did survive. And so yeah, but it's a challenge.
Yeah, well, you'll find something maybe in like advocacy work, because I know you mentioned in your submission that you would encourage people to kind of not settle on their care. So maybe that's kind of something that's in your future. Who knows?
Yeah.
So what advice would you have for anybody who is maybe found this podcast because they have found a lump on their testicle and they're just doing their research before they go get seen?
So I would say, I mean, most of the advice that I would give is the same advice you'd find in lots of other places, right? Which is, it's all about support, right? Like find areas of support, and the best way to get support is people who have gone through it, right? So like support testicular cancer support groups. There's a Facebook group. There's even like the Reddit community. There's also there's all sorts of the Testicular Cancer Foundation. There's like all sorts of support groups out there, and like they're just loaded with information and support. Like those support groups are the people that were like, email Dr. Einhorn. And I'm just like, what are you talking about? Like, and I found out who Dr. Einhorn was. I'm like, he's not going to email me back. They're like, yes, he will. And like just something as simple as that could be, and was for me, like life-changing, right? But like, I guess the thing that I would add that you might not hear elsewhere, like so many people told me, don't Google anything, like stay off the internet, like blah, blah, blah. And like, I understand, right? Because there is a lot of like false information on the internet. There's a lot of fear and all this, but like, I don't know. And everyone's different, I guess, but I don't believe that to be true about like, don't Google anything. Like, I think that's wrong. And it at least was wrong for me. Like, I believe in a person's ability to discern information, between good information and bad information. And I think that there's so much information out there, and knowledge is power. And I would say arm yourself with as much information as you can. It doesn't mean you have to believe everything that you come across, but the more informed you are, the more information you get, the more education you get, and the more you learn about what your options are, the better you'll be able to make decisions and manage your care in the best way possible. And I would say like I'm living proof that like if I had just stayed at NYU, and NYU is not a bad hospital by any means, it's a reputable, good hospital, but like if I had just stayed there and just blindly followed what the doctors there were telling me to do, I would be much worse off for it. So like, and like, there's no harm in like getting second opinions, third opinions, and just like finding all your options and resources.
Great advice. If anybody resonated with any information that you said, can they reach out to you anywhere?
Absolutely. So email me, and if you just put like testicular cancer in the subject, I'll know to check it and that it's not spam. And so you can email me at jonthefox, jonthefox @gmail.com. My Instagram is Mr. Fox Teacher, although I don't know how much longer that's going to be my Instagram, because my teaching career is limited, time limited now. But yeah, and I'd be more than happy to talk to anyone who needs it.
Well, Jon Fox, thank you so much for being on It Takes Balls.
Stephen, thank you so much. And also let me just say, like, I think what you do here is amazing. I think one of the challenges of survivorship for me and a lot of people is I want to tell my story. I think the opportunity to tell one story is really important, especially to a person/audience that can relate and has gone through something similar. I think that's so vital to the healing process. And so I think just like having this platform is incredible. And so thank you for having me, and thank you for doing this.
Well, it wouldn't be possible without people like you to tell your story. So I'm glad you were here.
Thanks, man.
For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org. You can also follow us on social media at Testis Cancer. We're on Facebook at Testicular Cancer Awareness Foundation.